When should I decide to go get tested for COVID-19?
Yeah, very, very good question. Again, we've been asked that question a lot lately. Um, so first of all, people need to stay home and stay away as much as possible. But if you do come in contact with somebody who you suspect is positive or is positive, still you got to go isolate yourself. Getting testing is not the right answer at this point. So if you're asymptomatic, go isolate yourself, stay home, and get in touch with us. If you don't have us, you should have us. So get in touch with us and we can guide you remotely what to do, how to manage the symptoms if you start developing symptoms at home. The problem with testing is there's several problems. Number one is the availability, right? Availability is low, and the number of tests being done, even at LabCorp and Quest, are limited in a single day. So they're already seeing a backlog of cases. There are still strict criteria in place at most of this testing that they will only test you if there is a clear known exposure to someone, and if you have at least two of the symptoms like fever, shortness of breath, and cough. And guidelines around that are kind of evolving right now, but we do know that a lot of the patients who have shown up to get tested have been turned around because they did not meet the criteria. So it doesn't make sense if you are a member to go get testing done without talking to us. But lastly, the most important part I think people need to understand is that testing is taking 5 to 7 days to come back. A lot can change in those 5 to 7 days. You can get re-exposed, you can get, clinically better or worse. And we are gonna be making decisions based on how you are doing clinically. And that test that we are still waiting on is not gonna help us manage you, basically. So I am not putting too much emphasis on getting tested. I am relying more on how you are doing, how you're feeling, and are you keeping your distance and protecting other people around you if you are having symptoms. But if we feel like you have gotten worse clinically, then we will guide you to go to an appropriate clinical care setting, which is most likely going to be an emergency room at this point, and get you taken care of through that route. Lastly, on the testing thing, I want to point out that we don't know how reliable these tests are. Like if I do get a negative test, how good is that negative test? In other words, we call it the false negative is high. So you may test negative, but you are actually positive, right? And then the other thing is we have seen multiple reports of people testing negative early in the disease process, and then they become positive later in the disease process, but you are still infectious to other people long before you even have symptoms. So unless we get fast, reliable testing, fast means that we get the result at least within the same day, and reliable means that at least I can say with about 95% accuracy that yes, I can believe this test. Until then, I am not relying too much on testing and recommending that we do care mostly based on how you are doing clinically.